Welcome to the President's Podcast with the Black Nurses Association of Greater St. Louis. You are listening live to Dr. Leonora Muhammad, President of the Black Nurses Association.
And I'm your co-host, Mia Glover, Vice President of the BNA of Greater St. Louis.
Yes, and welcome to our show today. Today, we have the pleasure of welcoming two women who advocate for women's health in the St. Louis area and for themselves as a woman. So first, let me introduce you to April Mickens Jolly. And Ms. April has worked in healthcare administration for over a decade. She currently serves as a leader at Planned Parenthood of St. Louis region in Southwest Missouri, where she leads teams that provide direct patient care and now leads strategy to advance equity across the organization and in the community. She previously worked at St. Louis Regional Health Commission, a community leader in providing and advocating for improved access to healthcare for vulnerable St. Louisans. April also serves, she's doing a million things around here, serves on the Alumni Board of Governors for Washington University and is active in several nonprofits as board members and volunteers. So welcome, April, to our show today.
Thank you so much.
Yes, and also on the line, let me introduce Ms. Bridget Body. She is a 51-year-old mother of one, a vintage costume jewelry reseller, a YouTube content creator. Oh, we need to talk a little bit more about that a little later because we might need some help. And a federal government employee for 27 years. In 2004, while she was in labor, she developed a rare condition, and that's what we're going to talk about a little bit about today, called Sheehan syndrome. And while she balances wearing many hats, the most important accomplishment of her is learning how to boldly advocate for her own health. So welcome, Bridget, to our show.
Hi.
Yes. Well, we are happy. We are all women on this show, so we need to talk a little bit about what's going on in our community. So April, let's start with you. So many people have heard about Planned Parenthood and mostly know that the organization helps, address women's issues. So tell us a little bit, for those people that don't know exactly what Planned Parenthood does or what you guys do at Planned Parenthood, talk a little bit about what the organization does and how they help women in the St. Louis area.
Definitely. So we offer reproductive and sexual health care. So if you're looking for pregnancy tests, STI testing and treatment, you have fibroids and you need to, have that situation looked at and, taken care of. We offer, advanced care. We offer the full range of sexual and reproductive care, including abortion care. And folks are coming to us at every stage of their lifespan. And so, our typical patient would be, a woman who's in their early to mid 20s, who's coming in for, STI testing or an annual visit. But we also have patients who are male, who are coming in for, some of those same services. We have lots of patients that are trans that are coming in for, gender affirming care. So we are offering care to all types of people across their lifespan. And we are very, very proud to be based here in the St. Louis area. But we also have clinics that are in Fairview Heights, and we also have services that we are offering in Springfield and Joplin. So when you think about our region, and the state, we are really serving people across a large area, and always, encouraging folks to take ownership of their health and their bodies, because you learning your own body and you owning your own care is what is going to create a lifetime of good health for you across your entire life.
Wow, that is a lot of different services. And one thing that you hit on is that you provide services for the male patient. I know we always talk about women, but I don't think a lot of people in the community knew that you service males as well, and male and transgender patients. So that
yes,
wonderful to hear. So you men out there, so listen up. You can go to Planned Parenthood. So now you know. So it's no excuse.
And
So
it's stigma free and judgment free. So we take all people who want to own their reproductive and sexual health care.
Okay, great.
Yeah.
Now, one question that the listeners may have too: do you have to have insurance to come to Planned Parenthood, or can
You do not. You do not. We serve people who have the means to pay without needing, assistance. We have, programs that help patients pay for some of their care. And we are always, of course, looking to do more for folks that cannot access care because of barriers like being able to, afford it. Now, I'm very happy that our state has been able to finally get to the point where we are expanding Medicaid. That's definitely a win for low income people in our state, right? So now single adults who make under $18,000 can finally qualify. And so we are going to be part of the process too, to help folks gain access to Missouri Medicaid as soon as the portal is open.
Okay, great.
Well,
Neil,
April, I heard you. Yeah, April, I heard you were the VP of Health Equity and Culture. What exactly is your role? What does that mean?
That's such a good question because I don't know very many people that have this title.
Right.
So I lead our, affiliates strategy around how do we really make an impact in terms of people's access to the same positive health outcomes. So not just saying that we offer care, but are we making sure that we are providing culturally competent care to folks?
Mm-hmm.
Are we erasing barriers that people have when they're trying to seek care? And so leading strategy around that. And on the cultural side, do we have, and are we building a workplace culture where everyone who works here, who many of our staff have been patients too, but do people feel like they can really bring their whole selves to work? Can they do their best work? Are we, intentionally focused on creating a culture where we're treating everyone, patients, staff, community, donors, everyone with the same level of respect and dignity? And so working on both of the I say like an equity spectrum. We're both looking externally at how we address equity through public policy and the services that we offer and how we offer them. And also looking internally at how we need to do better, because the same issues, right, that plague us outside of the walls of our offices and our health centers impact our workplaces too. So we're being really thoughtful about our own equity journey.
Oh yeah, that is wonderful. And I'm glad you touched on looking internally within the organization to make sure that the providers and the staff that's treating the patients understand the patient population that we have. Because we've seen in the news and the media about the effects of African-American women during childbirth and, reporting of pain and not really being taken seriously. So it really it's very good that you guys are looking internally within your employee population so that they can address those needs of the patients that they're serving every single day. So that is absolutely wonderful. So Bridget,
I love the part about the cultural competency, and I love the part about the policy, because we know that just because you say something doesn't mean it's true. And just because, if we don't look at the laws and really make a difference there, we're not going to get very far. So I like that.
Yeah, it takes a full 360 view, right? It's not just one issue. We have to show up to, advocate and support all of the issues that impact people's ability to access and seek their best health.
Yes, absolutely. And talking about advocacy, Bridget Let's talk a little bit about your own personal experience that you've been going through, and you suffer from a condition called Sheehan syndrome. And that's something I didn't really know anything about until it was brought to us when you decided to come on the show. So tell us a little bit, because I would definitely say that you have advocated for yourself and your own personal health with a condition that many might not know about.
So Sheehan syndrome is actually very rare. And once I got to the right doctor who was able to really break down for me what I was dealing with, he did actually say that Sheehan syndrome is a third world country disease. It's a disease that a woman in the Western world should not deal with because we have the advanced medical technology to keep a woman from having these issues during childbirth. So essentially what Sheehan's is excessive bleeding after childbirth. And what happens is with that excessive bleeding, your pituitary gland gets starved. It's basically a stroke of the pituitary. And so when you lose your pituitary, as a result, you lose a lot of the hormones that the pituitary gland makes. For me, I lost my thyroxine. I lost as my doctor corrected me, not adrenaline, but cortisol. But I did retain my estrogen. I would say that it took about, let's see, I gave birth in July of 2004. I started having these really strange symptoms about a month later. And I went back and forth to the doctor until November. And I was literally going to the doctor at a minimum once a week, because a lot of the symptoms I was dealing with, they were very, very hard to deal with. Severe migraine headaches, losing the feeling in my hands and feet. So yeah, they just didn't suspect that that's what it would be.
Yeah, so that had not occurred prior to you having birth. So this all kind of manifested after the childbirth.
Yeah, I was a totally healthy 34-year-old woman prior to giving birth. And about a month after giving birth, I started to have these weird symptoms. Now, keep in mind, during childbirth, and immediately right after I gave birth, I did see this experience of this large amount of blood just it literally flew everywhere. That's the only way that I can explain it. But by me being a first-time mother, I didn't know what it was supposed to be like. Really, the only thing I had to go by was a lot of the mysticisms that you hear about childbirth. Oh, you're going to bleed a lot. You will bleed for as many periods as you missed while you were pregnant. I had no idea that it was abnormal to bleed like a running faucet. I had absolutely no idea. So yeah, a lot of things I just took as normal until those major symptoms started for me.
Yeah. How would you say was your experiences with the providers that was taking care of you? So when you were having these symptoms afterwards and you were noticing things were changing and you were accessing healthcare, can you talk a little bit about your experience with the providers? Did they listen? Did they kind of brush you off? Or
it was a horrible experience. It was so bad that it's certain healthcare systems I won't deal with at all for the remainder of my healthcare journey. I was told things like, you are not a spring chicken. So, you just might not be bouncing back the way that a younger woman would. Oh, you're just exhausted because you're a new mom. But the whole time I felt that I know my body. I know myself, and I know that this is something new for me, being a new mom and recovering from childbirth, but I just didn't feel that the symptoms that I was experiencing should be as severe as they were. I was prescribed Prozac on one visit, and I accepted it because I was at a point that I really just wanted the situation to be resolved. And if the doctor felt that Prozac was going to resolve the situation, then I was willing to take it. Of course, it did not work. And like I said, it took until about November for me to finally be sent to a specialist and be diagnosed with Sheehan syndrome, which the first specialist that I went to didn't even tell me what the name of it was. They just simply told me, you need to take these medications and you'll take them forever. And that's it. When I got to the right doctor, that doctor was able to break down for me, you know, gave me the name of my diagnosis, explained to me how it happened, explained to me how it could have been prevented during some of those visits where I was complaining of certain symptoms. But since it wasn't addressed and it was, you know, given other monikers or name, you know, other titles, I guess you would say, then the disease went on ahead and progressed into, you know, full-blown Sheehan syndrome.
Wow, wow. Well, kudos to you for continuing to advocate for yourself and, you know, getting to the right doctors and really not laying up on it and kind of, you know, making sure that people really take you seriously. And that's really what we need in the community right now. So I'm glad that Planned Parenthood, on the flip side of it, is a resource where women can go and to, you know, understand what's going on with their body and be able to talk to somebody that's willing to, you know, give them the information. So, so that is really what advocacy about. And thank you so much for bringing that to the attention, because I literally had no idea about it. So, and would it be a
Bridget, I just want to say, I'm so sorry that that happened and that was your journey, because there are far too many stories about Black women being dismissed when they bring up issues in their care. And that's one of the drivers for why Black women and you know, pregnant people have much more terrible outcomes during pregnancy and during that postpartum period. So I'm sorry that happened. I'm so glad that you kept up at it though, and found the medical team that really listened and treated you the way that you should have been cared for earlier on.
Well, I would like to give a strong shout out to nurses, a strong shout out, because my aunt, who is a retired nurse of 35 years, at the time, she was in the labor and delivery room with me. And she could see that some things were not going right. And she actually left because, of course, she had no jurisdiction to tell these people, you know, you're not doing this right, you're not doing that right. But once I got ill, she was a nurse at Barnes at the time. And my aunt literally walked those halls to find a specialist for me. And when she did, she found the best one, world-renowned, to the point where even my primary physician was like, how did you get an appointment with this doctor? And I was like, I called them and I made an appointment. So I appreciate her to this day for that, because it was literally the right person that I needed to go to that knew everything about what I was dealing with.
That's yeah. Wow, just wow. Thank you for sharing your story. I definitely appreciate that. I know that we are on a hard stop and it's 5:27. We want to be respectful of your time, April. Thank you so much for coming on with us.
Thank you so much. I would love the chance to come and talk more later, but
yes.
I really do, you know, appreciate the chance to connect with you all. And Bridget, it was so nice meeting you too.
Nice to meet you as well.
Yeah, so this conversation has got to have a part 2. So we are definitely going to schedule some more time to talk to you guys, because I feel like there's just so many more issues that we can discuss. So, but right now, thank you so much for joining us. We appreciate you so much for taking the time to talk to our community. As Black nurses, we are out there in the community. We are advocating. April, we want to partner with Planned Parenthood and see what we can do, you know, in our partnership together to continue to get the word out, to continue to get women and young girls into addressing their personal and sexual health. So we look forward to working with you guys. So everybody that's listening today, make sure that you check out Planned Parenthood's website. Come to our Facebook page, YouTube, Instagram. This will be live tomorrow night, or when you watching this, it's going to be tonight. So continue to watch us, and we are out here, and we thank you guys. So continue, because we are the host to all things nursing
in the Lou.
Thank you. Bye.